this with other people if it comes up. So I'd had this idea for this initiative for 6 or 7 years, tried to bring it to the light and give it form, basically get buy-in a few years ago, didn't really get any. And recently a friend of mine kind of resurfaced it and said, we should do this, like front burner it, and let's have a meeting and let's start. And by the way, somebody else I know. And so anyway, it's starting to feel like randomly, it's like gonna try and take shape. And that's pretty exciting for me. And the idea is, if somebody has trauma, and let's say they're willing to do something about it, well, what we do is we say, well, I'm going to send you to a professional, right? Psychiatrist, psychologist, some sort of therapist, minister, priest, rabbi, maybe a holy guru, maybe Health and Human Services kind of in the town, or there's something like that. That makes sense. And maybe you try a few different professionals and they land on the right one. Maybe it's a AA meeting, or kind of something like that. And maybe you encourage them and give them a ride and give them pamphlets and that sort of thing. That's kind of what we do. You don't just say, well, talk about that with your sister, or next time you're feeling it, grab your closest coworker and hash it out. It's like, you kind of direct them to a professional. Maybe it's a book or something, like here's a book by Dr. So-and-so, like it's, and that's absolutely fine and appropriate. And the professionals are certainly studied and expert in addressing these things, right? But the reality is that most of the world that you meet is not a professional. It's the barista, and it's your coworker, and it's the person on the bus next to you, and it's your family members, and it's your neighbor. Most of them are not the trained professionals that we would want somebody with trauma to be interacting with in terms of their trauma. So my initiative is to create a group for people interested in learning about, contacting, connecting, addressing people with trauma, right? So in the group, it could be people that, are wanting to work on the trauma. And it could be people that, their spouse has trauma. It's not so much them, but they have a deep interest in it, or their kid does, or they're a school teacher and they deal with something. So it wouldn't necessarily, in my mind, necessarily be just people that are traumatized, but it just could be like, well, I deal with this enough in my profession, I'd like to engage on it more. So the idea is not to obviously supplant like actual professional medicine or counseling or advice, of course, but it's like provide another opportunity for people that are deeply interested in working to better themselves in terms of trauma, and hopefully help the people with trauma in some way as well, but not in like a clinical way, right? So in my mind, I call it Trauma Talk Tribe. That's what I've been calling it on my own notes, but maybe the name changes, we'll have to see. But I think the idea would be that we would get together. In my mind, I picture like a cozy living room, not, something just comfortable.
Right.
Maybe 4 or 5 people, something like that. Maybe once a month, maybe for an hour, like not a big production. And then we kind of do an exercise or two to kind of help us settle, right? Have some quiet time, invite people to talk, maybe not, maybe share a story, maybe ask a question, maybe do like a little teaching, like here's a little story, here's a little breathing technique for panic attacks, something like, just like a small little, like a 6-minute, here's just a little something today that might, soothe your vagal tone. That's it. And have a little bit of meditation or a little quiet time, maybe that's it. Have people chance to share again if they want. So it's not like trying to be a clinical intervention, but I feel like in our world we have clinical intervention, which has whatever the success rate it is, and then we have no intervention. I have no skill, and it's just chaos. It's just people don't know what to do, or they don't know that it's happening. So in my mind, I feel like, well, maybe there's something that people that are quite interested and maybe somewhat accomplished in their field, how can they address it without being a professional trauma addresser? Does that kind of make sense?
Mm.
So that's the kind of idea. So